Good morning, everyone. Today is Thursday, January 25th. Thank you so much for joining into our weekly healthcare reform webinars. It's certainly been active. There's been a lot going on since the president was elected about a year ago, or I'm sorry, sworn in about a year ago. So definitely a lot to talk about today. Just wanted to first introduce myself. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. I oversee the group health market for fully insured and self-insured, of course, and what is left of the individual markets in the state of Pennsylvania. We have these seminars, we have the webinars, hopefully to have a place that you can come to learn what's going on both at the local level and at the federal level, and how that may hopefully benefit or adversely affect you. So we do encourage questions, and you can answer those or ask those in one of two ways. You can either type in your question in the question box, and I'll answer that at the end of the webinar, or you can raise your electronic hand to the control, or in the control panel to the right of your screen. So if you can see me and hear me okay, in spite of my fumbling around, thank you. You can raise your hands. I appreciate that very much. Okay, so let's just get right into the agenda for today. So we talked a little bit about this last week. Within the budget was, the continuing resolution, was the delay of the medical device tax. That was not going to be enforced in 2016, but it's back in effect for 2018. So it was, but now it's delayed 2 years. There's also a 2-year delay of the Cadillac tax. This one always cracks me up because this thing has been kicked down the road so often. By the time it would ever be implemented, I think they can't even keep up with the parameters, with the rising costs of health insurance premiums in order to even enforce it. So I don't even think this one is ever going to see the light of day. But nevertheless, it was kicked down the road for 2 more years. Elimination or delay for 2 years of the health insurance tax. That's approximately 2.7 increase in premiums is affiliated with this tax. So of course that goes directly towards helping consumers with, and employers of course, with the premiums, hopefully. And of course the 6-year CHIP funding, they did approve the 6-year funding for CHIP with 88% federal funding for the first 2 years. After 2 years, the federal funding portion of CHIP will revert back to the pre-ACA levels. And I did a little digging, and average nationwide, I'm not sure what it is in Pennsylvania, but average nationwide is about 71%. And of course, with the biggest boom in the ACA as far as coverage in every state is the new enrollees on Medicaid, and of course, new children being approved either at cost CHIP or for free CHIP. I'm not saying it's a good or bad thing one way or the other. I'm just letting you know that there's a lot of folks in Pennsylvania, a lot of children covered under CHIP, and that's good that they are, but you can see the difference in the funding and what that might mean for taxes in the state of Pennsylvania when the funding reverts back. Also, I read an interesting article this morning that Senator Ted Cruz is pushing for another vote for the ACA repeal in 2018. Will it happen? I don't know. Stranger things have happened, so I'm not going to bet on that one, but the article talks about Ted Cruz, or Senator Cruz, basically securing some of the Senate votes that were previous no's. So again, whatever that means, I don't know. It would have to come through the House, of course, to get to the Senate. So we'll see. We'll see what happens. All right, so on to the agenda with the housekeeping. Aetna, they have a new master service agreement. Groups are going to will be receiving these new forms with required signatures. The details, because they're sending it out in a couple different shifts, some will go out next week, some will go out or have gone out, and some will go out the last week of January, which again is next week. So check out that article in this week's newsletter, but because I'm sure your group clients are going to be calling you asking why they're receiving this. Aetna has extended their $50 per employee AFA bonus for groups 5 through 50, and it's for 2/1 effective dates through January 19 effective date. So I think that is a great bonus. AFA is priced very well. It is a level-funded, self-funded program. They say that the rates are trending well. The credits towards renewal premiums, are trending well. So if you have any interest in us quoting the Aetna AFA or learning more about it, let us know. But $50 per employee, you can see how that can add up through all of 2018. Hi, Mark. There is also a new group business, new small group business application. So of course, be mindful of that. There is a blast that went out from Highmark, but we will get this on our site, so you can get it from there. There's also information about St. Vincent and UPMC Hamot. Essentially, the joint owners of St. Vincent Hospital and UPMC Hamot are joint owners of the Regional Cancer Center in Erie, and they've reached a mutual decision to dissolve their Regional Cancer Center partnerships and move forward in establishing independent cancer programs over the next few years. What it's saying is St. Vincent and UPMC Hamot will remain at the Regional Cancer Center during this period and are committing to ensuring that patients will continue to receive high quality, uninterrupted care during this time. So check out that article if you are in Western Pennsylvania, and that is something that's important to your clients. Orion Program. We talked about this the last couple of weeks on our webinar and what that means, and our formal Orion Program is really just a program that allows you to expand your business. If you, everyone on this call is either involved in some form of the health markets, whether it's Medicare, individual health, or group health. But if you are looking to reach out to your Medicare clients or look at your group members and reach out to them for either group life, group disability, or even individual life, business overhead expense. There's a lot of opportunity that could come from that. Obviously, a new revenue stream, a new offering for you and your agency, and we're going to help you with that. So if you have any questions on the Orion Program or want to learn more about it and how it works and how it could benefit you, give me a call. We are going to have Steve Clemens, who is the Vice President of Life Markets here at URL, talk next week, just how to recognize an opportunity for the life market. So he'll take about 2 to 5 minutes next week and talk a bit about what his department's doing and how that may benefit you, and again, create new revenue streams for you. Another article I read, HHS nominee for Secretary of Health and Human Services, Alex Azar II, has been approved. His appointment has been approved. Yesterday it was a little sketchy. That he is a former pharmaceutical rep, and it was sketchy because there was some resistance because he's not considered to be a huge fan of the essential health benefit. So, what that means moving forward, I'm not sure, but of course the article is saying that, maternity benefits will be removed for everyone. So that's not necessarily the case, but it could be interesting to see how all of this works out regarding the essential health benefits. And that brings us up to our open forum. While you're formulating your questions, if you just make note, next webinar is next Thursday on the 1st of February. I can't even believe it. And let's just see, let's get some questions here. Dave says, CHIP ends at age 19. I've heard that after that, access may be available. What is access? Access is a part of Medicaid, Dave. So again, if they are coming off of CHIP at 19, then they're considered adults. They could make application based on, you know, their living situation for access, which is, you know, a health plan through Medicaid. Will Highmark be paying commissions for new marketplace customers enrolled for 1/1/18? If so, how much? Yes, Dave, they are. Not much, and I don't know the exact amount. I don't have it in front of me. It's dollars. It's I don't want to say anything out loud, but I know it's less than 10, and I'm thinking that it's like about 5. But again, I will check on that, Dave. I'll have that over to you, and I will make sure that I address that next week. And Sean says, can I count on National General short-term medical plan for my clients? Are they legit? Yes, Sean, they are. National General National General purchased the Assurant block. So the same folks that we worked with at the Assurant program for the short-term medical, we're working with a National General. There's a lot of the same feel, and quite frankly, we're selling a lot of National General short-term. They do have that 4-popper out there where you can make application for 4 consecutive 89-day policies. At the end of one 89-day policy, they will be prompted to e-sign their next 89-day policy, and it's a pretty seamless process. So there is new pre-X every 89 days, but you know that's the law at this point, that short terms can only last a max of 89 days. So they're at least coordinating that it's a bit more seamless than going back and reapplying for 89 days each time. Can National General short-term, oh, I think you mean short-term medical go on for years. At this point, they've not, you know, because it is a rewrite each policy. There's no limitation in Pennsylvania that they can't continue to rewrite. They have to be 64 and a half or less to make application. So they could not continue that policy past 65. They could not qualify. And if they are turning 65 within one of the 89-day periods, they cancel it at the time they would be 69. I'm sorry, 65 for the 89 days. Hope that helps. That is all of the questions. I don't know if anyone has any others. If you do, you can certainly always reach out to me directly. My contact information is right down here, and right here I'm at extension 113. As always, I truly appreciate everyone joining in. I appreciate your partnership with URL and the business that you do choose to put through us. As always, questions, you know, again, you can reach me anytime, and I'm happy to answer your questions. And for now, I wish you all a very happy balance of the week and a wonderful weekend. Thanks so much. Bye-bye.